Welcome to another episode of the Bandage Podcast, a weekly wrap-up of the most trending healthcare news. Each week, join me and my co-host Alex Ross as we'll discuss the latest in healthcare, health IT, and compliance.
In this week's episode, we discuss new genes linked to autism, digital physical therapy, sleep duration and behavior of children, and telehealth for clinician burnout. Let's wrap things up. This is episode 19 for the week of February 10th. I'm Matt Moneypenny.
And I'm Alex Ross.
Before we get started, our diagnosis code of the week is W61.39, other contact with chicken, which is non-billable, as there are multiple codes below it that contain a greater level of detail.
Right. So actually, interestingly enough, this has actually happened to me.
Oh.
It was, unfortunately, it ended up coming back to me, right? Because the issue my healthcare provider had was they weren't sure which of the subcodes, the ones that are kind of more detailed, they should actually use, right? Because when I made contact with this chicken, it was at 75 miles an hour, and it promptly knocked me out, and I have no idea what happened next. So all I know is I woke up somewhere in a hospital bed with feathers sticking out of my scalp, literally stuck in my scalp.
That's kind of graphic.
Yeah, so unfortunately, I had to pay for the whole thing. It was quite a few bucks and quite a few clucks, and yeah, it's a good time.
Oh, wow. Could this be a diagnosis code for having the Popeyes chicken sandwich? I don't know if you've heard this, but there has been quite a craze involving the Popeyes chicken sandwich.
I don't know. Let's go test it out. I could use a chicken sandwich.
With that, let's get right into the news. First up, we have, check out my new pair of jeans. You like them, Alex?
Yeah, designer.
Researchers identified 102 genes associated with autism spectrum disorder, or ASD, from a large-scale genetic sequencing study. This could help clinicians better understand ASD and how to treat it. In 2015, there were only 65 known genes associated with autism. With these new identified genes, the researchers can begin to understand what brain changes cause ASD and begin to consider treatment approaches. This is pretty huge. I mean, it's almost double the amount of genes identified. So,
at what point do you have enough genes, though?
You can never have enough genes.
Right. I guess the question I have here is, as we're getting very specific with kind of where and how, what causes autism spectrum disorder, do you think that we're going to move towards potentially breaking it apart into different, more detailed diseases?
Spectrum things?
Right.
I mean, they always say that everyone's on the spectrum in some capacity. So
Right. So we've got kind of a wide range of different things, and we consider them all to be autism. At what point do we start like differentiating between, this type or that type? They may all exist within the same kind of umbrella. Do you think that genes and identifying the genetic component of autism spectrum disorder is moving us towards that direction?
Yeah, I'm not entirely sure, but I mean, they do already kind of do that in some capacity. I mean, granted, it's not that specific, but they do have like higher functioning and nonverbal and all that already. So there might be...
Right, but those are descriptors of individual people.
There might be subcategories within those subcategories.
But we haven't really said, okay, like here, these qualifications put you in that type, these qualifications put you in that type. And I think that'll become important as we try to learn how to, thrive together with all of these different types of needs that individuals have, right?
Yeah.
So I'm kind of excited for what that implies, having a genetic component and being able to see that. It also implies potentially earlier detection, which could allow you to intervene at an earlier point in their development, and I guess kind of headed off preventing, like a preventative health type approach to what will ultimately become something in the future.
What actually causes it, because we still don't really know what causes autism and how it happens. So something to keep in mind, and hopefully these new genes will help that.
Next up, helping squeaky hinges and broken bones. Hinge Health, a digital physical therapy startup, raised $90 million in a round of funding. The service is covered by most insurance plans, so people participating in the program don't have to pay out of pocket. Users are given 2 wearable sensors placed on varying areas depending on where their pain is, then do their physical therapy for 20 minutes, 3 to 4 days a week. Patients are provided with a tablet computer and personalized coach to take them through their key stretching activities. Between physical therapy sessions, Hinge Health delivers patient education.
This would be kind of cool. It's kind of almost trying to substitute in going to the physical therapy office and doing physical therapy with just doing it at home. Granted, you can't get some of the things that you can at a physical therapy office. Like, you're not just going to have like treadmills and machines like that, but it is still pretty helpful.
This is way different, though. I mean, think about what we do today. When you go to the physical therapist, they give you some type of exercises, right? Here's some stretches that you need to complete. You need to do these this many times every day, and then I'll see you in 2 weeks and see how things are going, right? So it's no different having this system that guides you through what you're doing at home. The only difference is now you have some type of coaching, some type of assistance, some type of guidance as you're doing those at home. I think that implies that people are going to be better at doing their physical therapy, leading to faster recoveries and ultimately better for the physical therapists who, are going to see better results, are going to be able to hold their patients accountable to what they need to do and help them improve their health.
Yeah, nothing is more demotivating than spending a couple months doing these exercises, and then you show up and you end up doing them wrong and nothing happened and you haven't recovered as you should have, so you have to start all over again.
And I think back to some of my experience working in kind of a healthcare space. I worked in direct care with individuals, and a lot of times they had these physical therapy exercises, right? And we were given kind of a pictorial diagram, like, here, look at this. This is what you're supposed to do. And we were never quite sure that we were doing it right because I individually, or some of my other coworkers, weren't the ones who were at the physical therapy appointment to be able to, see exactly what's going on. So I think a system like this in that industry where I worked would have been fantastic. Just having something that everyone can see visually, can get that guidance to be able to help people moving forward. I like this. I really do.
Yeah, and clearly a lot of other people think that it'll be helpful as well, considering it raised $90 million in funding. Next up, we have crabby kids from not enough sleep. Researchers found that depression, anxiety, impulsive behavior, and poor cognitive performance in children is associated with their sleep duration. The researchers studied the relationship between sleep duration and brain structure of 11,000 children ages 9 through 11. Lower brain volume of brain areas that affect these behavior and cognitive issues were found to be associated with shorter sleep duration. The recommended amount of sleep for children ages 6 through 12 is 9 to 12 hours. Behavior problem scores for children with less than 7 hours of sleep was 53% higher on average than those who got 9 to 11 hours of sleep. Their cognitive score was also 7.8% lower on average. This just goes to show you children need sleep, and if they don't get their sleep, they're cranky. I don't really know if you need such intense research.
Did we need a study to tell us that? No, but it is suggesting that there are actual physical impacts on the brain from not having enough sleep at that age, which causes these crabby behaviors that we all know. When I was a kid, my parents had me go to bed at 9 o'clock at night, and I didn't get up until 9 in the morning. I got 12 hours every day, whether I wanted it or not. And kind of like my middle years of teenagery and like young adulthood, right? Teenagery and young adulthood, I just assumed that they made me go to bed because they wanted their own time, because they were going to be up until 11 o'clock, and maybe they wanted to hang out and watch TV or something together, and so to get rid of the kids, send them to bed. But no, it was actually beneficial to my development. So thanks, guys. Thanks for keeping that time to yourself.
Bedtime is important. I was never much of a kid who enjoyed bedtime myself, but it is kind of interesting. I wonder if this is very similar to adults. I mean, obviously it's going to be not as much, but I mean, adults get cranky too when they're not getting enough sleep.
Right. I don't know. I recently kind of started tracking my sleep habits using my Fitbit. It's something I really hadn't done before. And I just assumed that I was getting 8 hours of sleep every night. But come to find out, I'm actually getting closer to like 6.5. Yeah,
I think that's probably the average for adults, because I definitely get around 6 too.
And I don't I don't necessarily feel tired every day. So, big difference here. They need twice as much sleep than me. That's fine.
Yeah, right.
I'm thankful, though, that I don't have to literally sleep half the day away just to, to not be crabby.
Yeah, that doesn't sound like fun. Especially you don't even have time for that when you get older.
Right.
So.
Got too much to do to sleep that much. Next up, burning out mental health issues with virtual appointments. Nearly 44% of healthcare providers experience signs of burnout. Providence Health and Services recognize the need for access to convenient mental health services, so it created Telebehavioral Health Concierge. This service provides same-day or next-day access to confidential, virtual appointments with mental health professionals. During the pilot program of the service, nearly 50% of participants said they wouldn't have sought professional help if they didn't have access to this service, nor would they have known where else to seek help.
It's interesting because it's using telehealth, which is widely trending right now in 2020, where patients can just pull up their phone and access an appointment with their doctor. But it's specific for doctors. So It's telehealth for doctors, which is an interesting niche. A lot of what I've read about healthcare providers and burnout is they don't feel like they should or are able to or allowed to have any kind of symptoms related to burnout or show any weaknesses because that's their profession.
Because they're doctors and they're supposed to be healthy, right?
But the reality is they're human too. And if they're overworked, then some bad things can happen, especially with their mental health. So
Right. And we obviously appreciate all the work that goes into making sure that we stay well, right?
Yeah. And I wonder if this will move into also targeting medical students because there is also a large portion of medical students who are burnout. That's usually due to, clinicals trying to understand that everything that goes on in the classroom, and then also realizing how much debt you get into while you're in medical school it puts you under a lot of pressure. So
yeah, I definitely see this service expanding, maybe even outside the medical profession, just burnout in general, just people who are, what do you want to call them? Like career
workaholics?
Workaholics Anonymous.
Yeah, right.
I don't know if I would call a lot of these people workaholics, right? They're not necessarily like addicted to the job.
They kind of are by trade.
Right. They're a forced workaholic.
Yeah, unless they are actually workaholics too.
But I do see this, expanding into maybe the business realm as well. And I don't know if that's their plan to expand. It kind of seems like they made it just for their people to begin with. But maybe it'll expand in kind of a different way. Other employers will start taking note of this and seeing the benefits that it's having for Providence Health and maybe implementing something similar or buying into a service that would allow their employees to access something similar.
Yeah, no, it'll be interesting to see what happens. Definitely kind of an interesting take on telehealth and just targeting one specific group of people, at least to start. So with that, we'll go into our next segment.
BREACH, Breach Patrol. It's a breach!
All of the latest cybersecurity breaches. Welcome to Breach Patrol, where we talk about the latest and not so great breaches all across the world. First up, we have College Needs Crash Course on Avoiding Phishing Emails. A series of email phishing attacks gave hackers access to over 5,000 individuals' data at St. Louis Community College. These hackers targeted former and current students and employees to gain access to data stored in their email accounts. Of those affected, 71 people had their social security numbers compromised. All accounts were secured within 72 hours of the incident, some within 24 hours. It took officials 3 weeks to fully identify what happened and accurately identify the affected accounts. There are no signs that any money was stolen from the student or employee accounts affected. 71 social media accounts. No, 71 social security accounts.
71, that's it?
That's
71, that's it?
That's pretty terrible.
I've got a story for you, okay? And I'm still mad about it, so this may sound like a rant. So my sophomore year of college,
yes,
someone in the business office who apparently needed some more training in phishing emails and scams and stuff like that literally sent the W-2s of every single school employee to a phishing scammer.
Perfect.
Every single W-2 of everyone who worked at that school.
Jesus.
Which included me because I was a student employee.
Yeah.
So, I mean, literally thousands of people just by email. Here you go. Here's their W-2s. I'm still mad about it, but so yeah, obviously that's something that happens at a collegiate level and really shouldn't.
No.
I don't. Does it say where they were able to get this information? You know, was it from school employees? Was it from students who, you know, engage with that type of information? Or
No, it doesn't really say how they got access. It just says that they did gain access. But the fact that it took, 72 hours, that's one person every hour they got a social security number that they know of. It took them 3 weeks to fully understand what happened. So It might not even be the whole length of the entire attack. It might be worse than what's reported here.
Mm-hmm.
But yeah, it just kind of goes to show you that even on the collegiate level where people should be hired and are experts within their field, they could still be victim of phishing attacks, right?
Not everyone at a college has to be an expert.
Wow. They still need to know.
They should at least be adept enough to know not to give out people's private information. But even still, colleges need to take a responsibility to ensure proper training, ensure that everyone knows exactly what's going on. And people need to be unafraid to question things. You know, if you get an email that's like, hey, send us this information, maybe you want to take that to your supervisor, to a coworker, and say, what do you think of this? Does this look safe? Does this look real?
Mm-hmm.
Because that it's just safer to do that. Swallow your pride, ask someone, and don't risk this kind of behavior.
Yep.
Next up, paying the toll for data breach. Toll, an Australian transport and logistics network, temporarily shut down a number of its IT systems after a ransomware incident. The targeted attack led to Toll's decision to immediately isolate and disable some systems to limit the spread of the attack. The attack impacted several customer-facing applications, but Toll said there was no evidence to suggest any personal data was lost. The company is launching a detailed investigation and working to restore all systems.
So what's interesting here is kind of, it's like a crosswalk to, they're a transport company, right? So one of the concerns with like self-driving cars is if they can be hacked into. Imagine if you're in autopilot mode on a Tesla or some other smart driving car and you're just sleeping, right? And some hacker gets into your car and literally just crashes it. That is a concern. It's kind of crazy to think about, but it is a concern. And this isn't necessarily entirely related to that, but having a transport or logistics network be compromised or shut down is kind of a big deal too. Imagine if this logistics company did deliveries for Amazon, how angry people would be if they didn't get their delivery within 2 days.
Right, and I know I would be. Last year when we got a lot of snow and my packages got stuck and were a day late, I wasn't that mad. But
yeah, right.
Yeah, I can understand that. That's big for a company though. One of the things that a transportation and logistics company probably markets themselves as is reliable and fast. You want to use us maybe at a premium because you know that we're going to get the job done. This is not the kind of thing.
Shut down and slow.
Right. This is not the thing that instills any confidence in this company being reliable. So it's going to be a tough road for them trying to come back from that and basically continue to sell their services after people see that they are vulnerable potentially to getting shut down at any moment. Right? And if they're vulnerable, who else is vulnerable? And maybe it's time for more security in the trucking industry.
And this could be another far-reaching thing here, but I wonder if a lot of hackers from other countries are targeting companies within Australia because of the natural disasters that are going on there with the fires and whatnot, because they might be realizing, hey, this is an opportunity for us to get into these companies because they're distracted with trying to figure out how to solve this problem with a natural disaster.
Right. Pretty sure I came across a statistic this week that suggested more than half of all attacks, all data breaches happen in the United States.
Mm-hmm.
But obviously that doesn't mean it's not happening elsewhere. And I think maybe you're right that there is some eye on kind of what's going on generally for when you might be able to do something that kind of flies under the radar, like a ransomware attack or other kind of like data breach. And that's it for this week's wrap-up of your weekly healthcare news. I'm Alex Ross.
And I'm Matt Moneypenny.
And we'll see you next week. Thank you for joining us for this week's episode of The Bandage. This week's episode was written and produced by eTactics. eTactics is a leading revenue cycle solutions organization committed to providing innovative, web-based solutions that improve our clients' cash management and customer relationships. Thanks, and we'll see you next week.